Welcome to this explainer. Think about the last time you walked into a new clinic or a hospital. You're sitting there in the waiting room, you look up, and you see that framed medical degree hanging proudly on the wall. And honestly, you instantly feel a sense of trust, right? We just kind of assume the person in the white coat has spent years perfecting their craft and, maintaining this impeccable professional standard. But what if that piece of paper isn't exactly telling you the whole story? Today, we're going to unpack a massive policy proposal that's aiming to fundamentally change medical transparency and accountability. We are looking at a really sweeping new initiative that's attempting to totally overhaul how the medical industry tracks the disciplinary records of its practitioners.
It's a super personal question, isn't it? I mean, think about it. When we go to a new restaurant, we immediately pull out our phones and check the reviews. When we buy a used car, we're definitely running a background check to make sure it hasn't been in some major accident. We constantly demand transparency in our everyday consumer choices. But ironically, when it comes to the actual people we trust with our health, finding out if a doctor has ever been suspended for negligence or, say, unethical behavior is incredibly difficult for the average person. For most patients right now, a doctor's past disciplinary history is essentially just a black box. The data might exist out there somewhere in the ether, sure, but accessing it, understanding it, and actually using it to make an informed decision, that's nearly impossible under the current infrastructure.
So here's our roadmap for today's explainer. We're going to hit 1, the doctor data gap. 2, the NMC's central tracking proposal. 3, how centralization changes accountability. And 4, what this means for you. Let's get into it. To really grasp why this new proposal is causing such a stir, we first have to diagnose the underlying illness in the current system. Section 1, the doctor data gap. The absolute core of the issue here is that the current architecture of medical record-keeping is just incredibly fragmented. In India, for example, medical professionals are usually registered with state medical councils. Now, these are regional, highly localized bodies, and this decentralized setup, it creates a massive data gap where disciplinary histories can just so easily slip right through the cracks. Let's look at a hypothetical scenario to kind of bring this to life. Imagine a doctor is found guilty of severe malpractice in the state of Maharashtra. Their license gets suspended by the state council. However, because these regional systems don't really have a fully integrated digital network, that exact same professional could theoretically just cross state lines, move over to Karnataka, register with the local council there, and essentially start completely fresh. The Karnataka council might not immediately know a thing about the Maharashtra suspension, and the new patients absolutely wouldn't. The disciplinary information exists, yeah, but it's siloed away in some localized filing cabinet rather than being broadcast to a national network. It's a huge blind spot, and it severely compromises patient safety. So how do we fix that? Section 2, the NMC's central tracking proposal. This brings us directly to the National Medical Commission, or simply the NMC. As India's apex regulatory body, they hold a ton of weight. They oversee medical education and regulate the practice for well over 1 million registered doctors across what is obviously a massive, incredibly diverse healthcare landscape. Now, getting dozens of localized bodies to suddenly start sharing complex disciplinary data under one roof, that's an unprecedented administrative undertaking. It's an absolutely colossal task. But the NMC is proposing this major shift precisely because they recognize that a unified system is basically the only way to modernize healthcare accountability on a true national scale. This shift we're talking about is literally a tale of two eras. On one side, we have the analog past. Isolated, decentralized state records. We're talking about systems often bogged down by physical files, delayed email chains, tons of bureaucratic red tape, and state-level gatekeeping. If one state needs info from another, it requires this manual, super time-consuming request. But on the other side is the proposed digital future, a unified, central NMC database. This means real-time, API-driven instant updates. It totally transforms this scattered web of independent state registries into a single, breathing digital network where data flows instantly, completely regardless of state borders. So how does this actually work mechanically? Well, the foundation is the creation of a national registry. Think of it as a universal digital footprint for every single medical professional in the country. By logging disciplinary actions centrally, the proposal just completely removes those geographical blinders we talked about earlier. This achieves what's called cross-jurisdictional visibility. Let me put that in plain English. It works exactly like a driving record or a credit score. If you get a huge speeding ticket or you default on a loan in one state, the next state you move to knows about it instantly, right? The system follows you. Well, this proposal applies that exact same logic to medical practice. A warning, a penalty, or suspension logged in the north is going to be instantly visible to a hospital hiring committee or a medical board down in the south.
Moving on to Section 3, how centralization changes accountability.
Now, having a national database is really great in theory,
but its real power lies in the workflow that it actually creates. Say a doctor is found guilty of unethical practices. Step 1. The disciplinary action is taken locally by the state board, same as always. But here's where the game changes entirely. Step 2, instead of that action going into some local file just to gather dust, it gets instantly uploaded and logged in the central NMC database. And Step 3 is really the most crucial part of this entire proposal. That accessible tracking creates an inescapable anchor. It completely eliminates that phenomenon we mentioned earlier known as jurisdiction hopping. A doctor can no longer just simply pack up and move to a new city to outrun their past, because their professional history travels with them digitally. It permanently links their actions to their identity, creating a framework where accountability is, quite literally, inescapable.
And finally, let's bring it all home. Section 4, what this means for you. Because at the end of the day, regulatory frameworks, national databases, APIs, they're just administrative tools. The real value here is the human impact. This seemingly dry, bureaucratic change translates directly into patient empowerment. By opening up that black box we talked about, a centralized system could actually pave the way for public-facing portals down the line, where you could literally search a doctor's name before you ever agree to a major surgery. But honestly, beyond just weeding out the bad actors who've historically hidden in the shadows of a fragmented system, this level of transparency really validates the good ones. It ensures that the immense trust you're placing in your medical provider is verified, that it's deserved, and that it's backed by a nationwide standard of care. Ultimately, it's all about giving you total peace of mind when you sit down in that examination room.
Now, while tracking disciplinary records centrally is obviously a massive leap forward for accountability, we do have to acknowledge that data is just a tool. It still requires really strict enforcement by the actual medical boards. A database can point out the problem, for sure, but human beings still have to act on it. So I want to leave you with this to chew on. Will a central database alone actually cure a medical malpractice, or is this transparency really just the first step in a much larger journey toward true healthcare reform? Knowing what you know now, will a centralized history change how you seek out healthcare tomorrow? It is a fascinating development, and it's one that's undoubtedly going to shape the future of medical trust. Thank you so much for joining me for this explainer, and hey, keep asking the big questions.